I heard some of the drugs are like the copay slip, for example, for like Xifaxan is up to like $900 and requires prior authorizations. And do you feel like the drugs are typically effective, or is it only a certain percentage of cases that kind of really get the drugs really help them?
No, that's a great question. To speak to the cost can be quite significant for some drugs. You mentioned Xifaxan. I've heard of copays up to 2,000.
Oh my gosh.
So
Yeah.
it can
Wow.
be quite cost prohibitive to go on these drugs. Other drugs are not so cost prohibitive, but they, as I said, don't always work that well, or they have side effects. And these drugs, in terms of even their effectiveness, if you look at all the trials, you're looking at most efficacy rates of 30%. Majority are in the 15 to 20% over placebo, right? So, these patients are suffering with all these symptoms, and 70% of the time, they're not going to get better, even with drugs. So we have to start thinking of different ways and start asking the question of what drugs would I need next versus what can I do to get to the root cause of these symptoms?